Without further ado, ladies and gentlemen, please welcome Professor Luís Novais.
I'd like to thank iMed for my invitation. I would like to thank our guest speakers for their participation. Sorry, passed so many slides. Okay. Ramon Cajal is the father of neurogastroenterology. He discovered a new type of cell, interstitial cell of Cajal, the pacemaker of gastrointestinal tract. In the evolution of esophageal manometry, the first high-fidelity manometry system was developed in 1970 by Dodds and Endorfer. Later introduced esophageal manometry in Portugal, the mapping manometry in 1999, and 2000 close proved that this new technology, application of topography methods, is important in medical practice of esophageal manometry. In the esophageal high-resolution manometry, the determination of three determinations are important. The first, integrated relaxation pressure, the contracted relaxation point, and distal lenses are essential for diagnosis. The Chicago classification allows the diagnosis of esophageal motility disorders. The last was in 2015. This year was not possible realization of Chicago 4 by COVID pandemic, but will be held next year, we hope. The Chicago classification, as you can see in these slides, is a hierarchical approach. Firstly, disorders of esophageal junction, obstruction. Second, disorders of peristalsis. And third, disorders of minor disorders of peristalsis. The subclassification of achalasia are in three types. Type 1, classic achalasia. Type 2, achalasia with esophageal incompression. Type 3, spastic achalasia. The subclassification of achalasia is important and has been shown to be a prognostic indicator and informs treatment strategy in the achalasia patient. The last ACG guidelines provide guidance on best to diagnosis and to treat patients with achalasia, and the importance of high-resolution manometry. In the subset of achalasian patient is effective in the esophageal study of esophageal junction because it's not possible to through the gastric esophageal junction. In this patient, in our lab, you test less flexible 3D high-resolution manometry catheter or the probe could be more effective to study in AG junction. You see the last part of the slides, and you could see when you could not pass the sphincter, but with this technology, you can help you in diagnosing a study showing gastric esophageal junction. Manometry with impedance is also useful in the evaluation of other segments of the digestive tract. You can see there pharyngeal evaluation, antroduodenal high-resolution manometry, colonic high-resolution manometry, Anorectal manometry provides available information. You can see resting pressure, squeeze pressure, retroanal inhibitor reflex, study of defecation. It can help for diagnosis of the pelvic floor dyssynergy. And you see, you can have type 1, type 2, type 3, and type 4 dyssynergy. In this slide, you can see the three-dimensional high-definition anorectal manometry as new technology. In our lab, you use now a critical barrier which will be created for our group. Thank you very much for your attention.